Good afternoon to you all. Karen McGowan is my name, and I'm absolutely delighted to be joining you all for the Vanderbilt Global Collaborative Series. And I want to place on record my sincere thanks to Dr. April Capu for organising such a wonderful event. And I was truly honoured to be asked to speak on nurse practice from an Irish perspective. So as I said, Karen McGowan is my name. I am an advanced nurse practitioner in gynecology and the former president of the Irish Nurse and Midwives organisation. And my background is I was an emergency department nurse for 16 years, and 5 of those were as a nurse practitioner, which was a great foundation to build on my nursing career. And I'll explain more of that later. So the history of advanced practice in Ireland. The emergence of advanced practice occurred as a result of the recommendations made in a report on the Commission of Nursing, and that was back in 1998. The proposed clinical career pathway for nurses into specialist roles, this is what we achieved. This secured the basis for further professional development of nursing and midwifery. We had our first accredited advanced nurse practitioner, which was in the emergency department in 2001, Miss Valerie Small, who was a trailblazer in setting up services in St. James's Hospital here in Dublin. Currently, we have 809 advanced nurse practitioners or NPs registered in Ireland. That is just under 3% of the workforce, and we have a commitment from government here that we will increase that to 5% of the workforce, which is extremely positive because we know what nurse practitioners can achieve and the service that they deliver. So there are 2 pathways to become a nurse practitioner in Ireland. So you start off as a candidate, and there are 2 pathways. So pathway number 1 is approved by the Nursing and Midwifery Board of Ireland. It is a master's programme in advanced practice, and you may apply for registration in the same way as any nurse who completes a registered postgraduate qualification. This is quite an intense pathway because every component for you to be registered is included in this 2-year program. So it is an intense one, but again, an extremely worthwhile one. Pathway number 2 is very much a developmental pathway, and I suppose it's the more spicier one is what I would say. This is the pathway I would have went on. Very much development. So you can be a registered nurse and midwife with the Nurse and Midwifery Board of Ireland, be registered in the Nurse Prescribers Division, hold a master's degree or higher in nurse and midwifery, or a master's degree which is relevant or applicable to the advanced field of practice. The master's programme must be at level 9 on the National Framework of Qualifications, or equivalent to that. And educational preparation must include at least 3 modular components pertaining to the relevant area of advanced practice. And in addition to clinical practicum, this is really, really important. I suppose I would have worked as a nurse and a nurse manager for many years, and I would have done these small modules in my own time because there was no positions available at the time. And again, it was great for me because I was able to do these at my own time. So again, these both pathways are very much active in Ireland, and there's definitely a way around both of them. It just depends on what way you progress from qualification and to the area of expertise you want to expand on. So the competencies for advanced practice in Ireland, the Nurse and Midwifery Board of Ireland released are the domains of competency in 2017. So domain number 1 is our professional values and conduct. And again, this really demonstrates our own accountability, our responsibility for our practice. It shows our continuous professional development, and this is where we would identify our boundaries of care and our scope of practice. We want to practice to the top of our scale, and this is the domain to demonstrate that. Domain number 2 is clinical decision making, and again that's about us providing a holistic assessment using evidence-based practice to form a diagnosis and to promote us as autonomous practitioners. And again, domain number 2 is extremely important, and what is really important is that we are excellent at history taking, because the patient will often tell you, as you know, what the problem is by just by telling them the history. So it's really it's so important. Domain number 2 is the knowledge and cognitive competencies. So again, that's using your knowledge to transform your practice. It's about using evidence-based research, audit from our own practice that will inform our future practices. So again, it was so essential to our practice. Domain number 4 is communication and interpersonal communications. And again, like any practice, it's about teamwork, and it's about managing our colleagues' expectations, our writing from a professional point of view, research and so on, our plan of care, and following hospital policies, because these are the things that will keep us safe in our practices. Domain number 5 for us is management and team competencies. So again, knowing what your team is, where the strengths are, where the weaknesses are, and building each other up to a level of competency. And it's about managing those weaknesses, but in a very much a supportive environment. Domain number 6 is leadership, and to be able to demonstrate leadership in the design of the service, the vision for the service, and to advocate for the service and implement these changes for the greater good of the patient cohort that we are looking after. So I suppose my own pathway is my own story, I suppose, for the want of a better word. I was an emergency nurse for 16 years, and I absolutely loved it. I thought I'd never leave the emergency department, because I thought if you cut me down the middle, I would be an ER nurse through and through. But I suppose things change and your values change, and you know what you enjoy, what gives you joy in your practice changes too. So 5 of those years I worked as a nurse practitioner in the emergency department, and we would have seen an array of symptoms presenting to the emergency department. Those with chest pain, abdominal pain, ear, nose and throat, VTE issues, to name but a few. And again, we would provide all the services. We would take phlebotomy, we would take our bloods, our arterial blood gases, we would order our x-rays or ultrasounds, whatever was the diagnostic of choice. And there was a great sense of pride in that job, because there's a great turnover of patients, and you know there is a real sense of satisfaction. But what I really noticed, and during the COVID period, that there was a lack of service in terms of gynecology services within my own hospital. I work in Beaumont Hospital in Dublin, in Ireland. So it's a hospital that is based north side of the city, and it is a very busy hospital. It's a very busy teaching hospital, and but again, our gynecology service here is quite a small one. But I could see that there was gap in service. Like any nurse and midwife, I think we're very well placed to identify, you know, where the gap is in certain services. But again, I think nurse and midwives come with the solutions to these problems, and I think that's what advanced practice really demonstrates as well. So I seen that there was a gap, and you know, I'm hugely passionate about women's health and promoting, you know, female autonomy over their bodies, and you know what's normal, what's not normal, and when you should, you know, seek expert advice and so on. But so with that, I gathered my data, you know, because I was seeing these women that were presenting to the emergency department, and I was like, God, you know, these women could be better served by an advanced nurse practitioner practice. And so I went to and gathered my information, gathered a bit of research like we do, and it doesn't matter where you are, and I could really identify that there was so much more we could improve on patient care. So that made me go to like the consultants in gynecology, going to business leads within services, and you know, identifying, you know, what a nurse practitioner can bring to the service. And that's what I did. So I was like a dog with a bone. I kept at it, kept pushing, you know, and identifying pathways that we could avoid admissions in the emergency department, and that we could better care for these patients as an outpatient basis, because that is the model of care that is commonly used here in Ireland. But again, the move from the emergency department to potentially the gynecology department was a big change in terms of environment, but one that I really craved because I felt I could make a bigger impact, and one that would give me a real sense of achievement and joy in providing such a service as this. So I eventually interviewed for the position of the gynecology nurse practitioner, and I was a successful candidate, and I've been in the role now for the last year and a half, and I absolutely love it. Absolutely love it. I couldn't recommend it enough. So before I made the move, like obviously, like any nurse midwife, we do our homework. I was leaving a team of, like, 5 nurse practitioners. We're a very supportive team, and again, team-based nursing is really reassuring, and it's a supportive environment for you to grow and learn from each other. And I was going to be going solo, so I was really full of anxiety and but excitement at the same time. And I really relished the opportunity of taking on a new role, and having the experience of what a nurse practitioner does and what we can do and what it takes to implement a new service was really important to me. So service development, the steps to success in this. So for me was number one was identifying the gap in service. That was really important, where the need is needed the most. So it was again really important for me to collaborate with the key stakeholders, our consultants in the gynecology service and our consultants in the emergency department, because if they could see the benefit of this cohort of patients being managed so much more streamlined and in a time sensitive manner as well. So this again was just building the case. It's about using the data to inform our practice. So a business case was compiled and developed, and we worked on that and put it in. For obviously everything needs to be funded, so this essentially took the guts of about a year or so to work on, but again, one that I was really like so wanting to happen, because this is where I seen my future, I suppose. So, and then obviously then we advertised for the role, and obviously I was successful then and became into position. So service development from the beginning, again, it was identifying the need, and as I say, nurses and midwives are very well placed to identify where the needs are in service and where they can find the solutions to these problems. The initial scoping of the service with the key stakeholders was so important. The business case, recruitment of the nurse practitioner, and developing the advanced nursing service. So it's again taking in the vision for the role. Where do you want to see this? What cohort do we want to address? What can we improve? Is it a waiting list? To name but a few. So again, it's about preparation for the recruitment and the registration, and obviously then the engagement for clinical supervision and expansion of practice, which is really important, because obviously I was in the emergency department and I had my own scope of practice within the emergency department, and changing to such a specialised area such as gynecology. Yes, I would have seen women presenting with gynecology disorders, but again, it was so much more, because I was going to be looking after them after they've had their care or procedure or whatever the case may be. So that was a huge intake, but one that I absolutely relished. One that I probably would have felt very overwhelmed initially, but again, and here we are, there's a picture of an elephant. Why has she got that up? I often think about big projects that we take on as nurse practitioners, and I'll often say, I come with the approach of, well, how do you eat an elephant? One bite at a time. So that's the answer. It doesn't matter how big it may seem or how daunting it may seem, but again, one bite at a time and you'll get there. So I'd be very encouraging of anybody that would be thinking of dipping their toe into advanced practice, or even pivoting from where they are to somewhere very different. But again, I would encourage them, especially if this is a keen area of interest to them. So gynecology AMP, that's where I landed. This is me when I got the role. I was obviously very stressed, lots to be doing. This role in gynecology is very well established nationally. And I suppose the Department of Health launched the action plan after listening to women of all ages and from all walks of Irish life. And they are changing the way we work to improve on women's health in Ireland. And this plan focuses on improving health outcomes for women here. And this is really, really important. And it was very supportive to me because I was obviously new in the role, and obviously coming from a small service in quite a large hospital. I was the first one in the hospital, so a lot of boundaries had to be pushed and so on. So this health action plan lended a lot of support to developing my role within the hospital. The National Women's and Infant Health Programme is this in NWIP is what we would call it in Ireland. The role of the NWIP in the Health Service Executive is to lead the management, organisation and the delivery of maternity and gynecology and neonatal services. So NWIP really strengthened these services by bringing together the work that is currently undertaken across our primary, community and acute care areas. And it's so important to engage and to see where the vision for these roles as we progress the ambulatory gynecology model of care. So again, it's an awful lot to take in, but all that is really, really important. And I suppose we look at, how do we perform? How do we know we're providing a good service? We have national key performance indicators, and in my hospital, one key performance indicator was in the area of postmenopausal bleeding women. So we were performing very poorly in those key performance indicators. And obviously postmenopausal bleeding women, you have to think we're looking for, we need to find those that have an endometrial cancer. So it's an incredibly important pathway of care. So I felt it was absolutely necessary to hone in on this area from the start of my role. And to implement and establish the nurse-led postmenopausal bleeding pathway. And that was the focus of my job starting off, to implement this pathway so that women that are postmenopausal, who are having a bleed, that are seen by myself or the consultant, and they have their hysteroscopy or they have a biopsy obtained and any treatment that they may require, and this all must be done within a 12-week period. And again, there's great organisation in that regard, but again, one that is very, very rewarding. Starting out in this area, as I said, I wasn't a new AMP, but again, it was a new area. But again, everything can be overwhelming, and help from colleagues is really, really important. And as I said, this role is very well established nationally, so it's about looking to your colleagues for advice and support. And that was I got that in abundance really in Ireland, I have to say. Getting advice from your colleagues is really, really, really so supportive here. And I often say to myself, remember the elephant, one bite at a time. You just keep going forward, okay? So this is just an example of the pathway that I would use. Now, this is something that is a national pathway. So all the gynecology nurse practitioners in Ireland use this algorithm, okay? So this, as I said, is really, really important to look after these women appropriately and in a timely manner. And again, it's about the presenting complaint. They may go to their general practitioner first initially with, vaginal bleeding that they may not have had maybe in years. So the GP will make a diagnosis, take a good health history, and obviously do a clinical exam, and they may order a pelvic ultrasound to assess the lining of the endometrial thickness. If this is not done, and when I get the referral, when it comes to me in my hospital, I'll order the ultrasound and get that done in a timely manner. And even implementing this nurse-led postmenopausal bleeding pathway, there were tweaks along the way. It was really, really important to make sure that everything was done in a timely manner. So again, it was about establishing relations with key stakeholders like our radiology department. So, you know, you have a postmenopausal bleeding woman, you need to get an ultrasound as soon as you can, because, you know, you're either going to bring them for a diagnostic hysteroscopy, or they may be just coming for a physical exam in the department. So the first point of contact, I contact the patient virtually, take a really good health history, and then I decide what is needed or required next. And again, it's about referring back to this pathway, and this, by following the pathway, you'll never go wrong, you know. And as I said, it goes through it, you know, after the GP referral, the triage system, that's when I would pick it up. And then obviously the ambulatory gynae clinic. I don't have an ambulatory gynae clinic in Beaumont, but a lot of my colleagues around Ireland do work in these ambulatory gynae clinics, which is like a one-stop shop, where they would come in, they would have their assessment examination, they'd have their ultrasound then and there, and then if the need arose that they needed a hysteroscopy, they'd go into the next room and have that done. And it is really, truly an amazing service, and one I aspire to achieve. But again, it's all about funding, and it's about building the case, and using the information that we have and the research to prove that, you know, this is money well spent on women's health. So again, this is just a little snapshot of one of our pathways. We have many different other ones, but again, this is what I'm very passionate about, because again, so we're looking for the endometrial cancers in women. So this is a little snapshot of my own little bit of research that goes on with myself. So these percentages along the way is our compliance with the key performance indicators. Okay, so obviously, if you can see in the middle of the graph, August, September and October, November. So I took up the position in the September. We were starting to meet the KPIs at 90%, 92%, and then we eventually hit the 100%. And that demonstrates what nurse-led services can do for specific services. So, and I'm delighted to report that 100% key performance indicator is being continually met this year as well, and it's something that I'm really proud of. But again, it just demonstrates what the potential is in terms of advanced practice. What can we bring to the table? It is very driven by one person, and that is me. And I do hope, by gathering all the data that I am doing, is that we will eventually recruit another nurse practitioners who will be able to give me that continuity of care, you know, if I go to a conference, or, you know, if I do take leave, you know, so there's no guilt. There's somebody back at the ranch that is taking care of all these lovely ladies. So it is a long journey, you know, and when starting out, you might look at the road and go, oh my goodness, this is gonna, I don't know, am I ever gonna get there? But it is worthwhile, and long journey, but it's so worthwhile, so rewarding, and I'm so glad I made the change. Genuinely, it is an area of practice that gives me great joy and great satisfaction, and it's great to be looking after women and giving them that education, giving them that support as they go through these journeys. Because obviously, I look after women that we do diagnose endometrial cancer, so for them to be so familiar with me from the virtual consultation initially, then they come to the hysteroscopy or they come to our clinic, it's the same person that they're seeing, and then they're so delighted to, oh, you're Karen, and it's great to put a face to the name, and they get that reassurance. And it's really important for me that they feel assured as part of the gynecology service we're providing. So something in Ireland that we're very, very passionate about, and that is the governance over our practice. So what we do in our hospitals, and in many hospital groups as well, we have a service level agreement. And what is this? This is a contract between the service provider and its internal and external clients. So why do we need one? This is really, really important. Why do we need one? Of course we need one to ensure that relevant governance structures and reporting relationships are in place for all parties to support ongoing advanced practice services, clinical supervision to the candidate nurse practitioners and the registered nurse practitioner. Because obviously I was a registered nurse practitioner, but going into a very specialized area, I still need, you know, clinical supervision until, you know, I'm completely comfortable and I'm very aware of my own scope of practice and what keeps me safe. And the parties involved in the service level agreement, this is really important. It's the advanced nurse and midwifery practice governance groups within our hospitals, the directors of nursing, and the key stakeholders supporting the candidate nurse practitioners and registered nurse practitioners. Those would be the consultants and the extended team. This is an example from the Office of Nursing and Midwifery Services, which is headed by Dr. Geraldine Shaw. So she leads out on nurse practitioner services. So this is really important. And you can Google this, like it's on the Health Service website in Ireland. So it's a national guideline for development of advanced nursing and midwifery practitioner services. So it's a really helpful, it's a step-by-step approach how you can implement and start your service, you know, again with the ideas that we find through our own practice. And again, this is just, as I said, our service level agreement. This is really important. These are just the headings that you have because you're identifying where the boundaries are, where your level of service wants to be. And again, this can always be reviewed at, you know, once you've done a year of practice, then you review. We're always constantly reviewing and researching and auditing our practice. So this is where we can change our service level agreement, where we want to expand on the service or add to the service or build on to the service. So it's really, really important to have this because this is what keeps us safe. Yes, we are all autonomous practitioners. We are protocol driven, like some that I identified earlier. But again, this is something that it's not concrete. This is something that can be expanded on once we are at a level of comfort and autonomous practice. So, but again, it's just food for thought, and you know that's how we evolve and build in our practice here in Ireland. So moving on to, you know, how do we progress the profession? Okay, so this is something I'm really, really passionate about and always about leading by example. Okay, it's really important to me. So in my mind, all good ideas start with coffee. So during one coffee morning, I was just talking to two of my colleagues who are nurse practitioners. We were discussing that more needs to be done in terms of our own educational needs. So, you know, the continuous professional development. Sorry, I'm losing my words now. And there's so much we can learn from each other. So we had a great discussion. You know, what can we do? What's out there? It's about looking to your colleagues. What are other hospitals doing? So we looked to our medical colleagues and how they were conducting grand rounds, which is an American model of teaching that was led by Dr. William Osler. And we said, you know, well, it's a very proven model. And we said to ourselves, well, why don't we do our own version? So we did. So again, it's about gathering the information and it's about, you know, getting the research, and we investigated and we found our own way around the challenges that are always there when anybody wants to implement any new changes to any well-established hospitals. So we established advanced nurse practitioner grand rounds. So it has been a huge success here in Ireland, and other hospitals in Ireland have now followed in our footsteps and are implementing their own nurse practice AMP grand rounds. It's a wonderful, wonderful opportunity for us all to gather. We do it every second Wednesday, and we have different specialities presenting on their service. They may be presenting on research that they conducted. It can be anything. It can be we can even just discuss case studies of combined care, and it's really, really interesting and very thought-provoking, and it's very interactive. So again, I'd be like very encouraging of anybody if they were thinking of what do they need to, you know, to reinvigorate how we learn and things like that. So it's really, really important. So what did we learn? So morning coffee can lead to great things, number one, and the development of grand rounds team. So, you know, if you want to add consistency to anything, you need to have a team around you. So we developed the AMP grand rounds team. So again, so it's not left to the one person all the time organizing. We have a team approach, and we each take turns in leading out and emceeing the grand rounds. We also applied for continuous professional development points, And this was very encouraging because, you know, we all want our points, right? So this is what makes it attractive as well. But it's also an opportunity to have a cup of coffee in peace and do a bit of learning before our busy days start. So I am in the RCSI, the Royal College of Surgeons in Ireland. We are a hospital group, so we have other hospitals in other counties in Ireland, but we are the one hospital group. So we established our AMP Grand Rounds in Beaumont Hospital first initially, and we thought, wow, this is really good. This is like we have to bring this on the road show. You know, this is really, really interesting. We need to share this. So we went to our other hospital groups and said, look, we need to go bigger again. So we developed then our inaugural RCSI group Grand Rounds. So this involved all our colleagues in other hospitals in the one group to meet once a year to have a full day conference and present and discuss different services within the hospital group. And again, it's a wonderful way to meet people, because when we started in Beaumont, I didn't realize how other services were well established, and who knew they were in the hospital. But it was a great way to meet more colleagues and to network with them. The RCSI group was extremely supportive to us establishing this annual event, and we are now 4 years into it now. We had it in Beaumont first. It went to Our Lady of Lourdes in Drogheda last year, and now this year, sorry, it's only 3 years, apologies, and this year it'll be in James Connolly Memorial Hospital in Blanchardstown. So it's really very exciting, very encouraging, and again, it's very much encouraging that culture of support and mentorship that we really pride ourselves in Beaumont on, because we're very much about helping people up the ladder, supporting them. Mentorship is really important, and we would, help our colleagues and help supervise them as they, progress their way through their candidacy. The RCSI Grand Rounds is a great way for us to meet other colleagues in other hospitals and to network, and to be able to ask each other's support is so important. So this is a picture of us at our first RCSI group Grand Rounds, and we had our Chief Nursing Officer, Miss Rachel Kenna, present, and we had our Director of Nursing, Patrina Donnelly, who was a great support to us when we approached her with this big idea. And from the RCSI, with Dr. Jarlath Farley, who is the Programme Director for Advanced Practice. It was great to have him as a support, and Paul Mahan, who is heading up operations and education within the RCSI group. So my colleagues who we meet for coffee and have great discussions are just to the left of the picture alongside myself. So again, I'm really, really proud to be part of this wonderful team. I have Sarah Garvey, Tinsey, and obviously Sarah has been a real trailblazer in terms of leading out on our AMP Grand Rounds, and Fiona Colbert as well, who is a nurse practitioner in cardiology. It's a great support group, and you need that when you're venturing on new ideas, and it's a different way to educate ourselves and our colleagues, and to learn from each other. So this is another idea that we don't stop when it comes to education. And as a year in when I started out in gynecology, I really realized that there was a real lack of information. So I felt that it was really, really important for me to develop the Ladies Lounge as a result of meeting these women in clinic, and that they really wanted more information. And it was so necessary for us to devise this Ladies Lounge so that we could discuss women's issues in a safe place and to learn from each other as well. I had the first event last September, which was a huge success, and I had a further event then in March of this year in the Richmond Event Centre in the Irish Nurse and Midwives Organisation. And again, it was really well attended, really reassuring, positive. People want more like this, so they're queuing up the door. When's the next one? So again, it's really, really important. And again, I'm very passionate about women in the workplace, and to empower them and to give them the information that they need over their body autonomy. And again, like, we see a lot, I look a lot after women who are postmenopausal or menopausal or perimenopausal. And again, this can be a real blur area for people. They don't know, oh, I have some symptoms, just to give them the information, to even just a symptom checker, just to get them to try and reflect on themselves. How are they doing? How is your health? How are you feeling? Just to give them that. And if we can keep women well, we can keep them in the workplace longer, because I mean, that's when we excel, that's when we feel good about ourselves, and when we're happy in work and things are going well. But when our health is impacting our place of work, that's really important that we make that better and improve on that. So one of our speakers was Dr. Yvonne Harnett, who is our psychiatry reg. She discussed a fantastic session on mood disorders over the lifespan. So this was essential for everybody, like, it doesn't matter what age you are when you presented. And I ran the first one obviously last September, and this was for staff of Beaumont Hospital. And you could be, it wasn't just all nurses, it was, nurse attendants, radiology colleagues, some of our non-consultant hospital doctors. Many people came, and there was really well attended, and the feedback was excellent. Such a small idea, but it can really add value to your place of work. We also had some dietary advice from our dietitians and ophthalmology colleagues. And again, these can often be the first signs of menopause, having the dry eye, issues with dietary, a GI upset and so on. So these are really subtle, but again, just to get people thinking about themselves a little bit more and just to prioritize their health. So I suppose the top tips for setting up your service from an Irish perspective: connection is key. Network, meet your colleagues, meet your other A&P colleagues in your hospital. A&P Grand Rounds was a wonderful way for us. And again, you can establish that mentoring process within the hospital, because it's so important, especially when you're new, as you are vulnerable. So to know the colleagues that have been through the process, it's great to get that reassurance. From a national and international point of view, like if there is a special interest group, like for me in gynecology there is, so I was lucky enough. But if there isn't one, start one. That's what I'd recommend, because like some of my colleagues who are in the network in Beaumont, there wasn't one, and my colleague who looks after venous thromboembolisms, there wasn't one nationally in Ireland, but she is starting her own one, and like she's blazing a trail as well in terms of VTE care in Ireland. And I look forward to seeing that progress, because I've no doubt she will be extremely positive in her outcomes. When you look to the nurse specialists and consultants, it's about looking about where you can bridge the gap, where you can improve in the service. It's about really reflecting on where you are and where the service needs to go. And again, collaborating, I can't emphasize this enough. It's really, really important to collaborate with others in other hospitals. And as I said, we have the RCSI hospital group, but again, it's, don't be afraid to, reach out to people in other hospitals, because you can learn so much from them. Particularly, I know I learned so much from attending the ICN APN conference in August of last year, and it was just an amazing way to meet NPs from the US, and it was so exciting to hear what other people are doing and how they see the governance and so on. Social media is a massive area, and Twitter, LinkedIn, etc. Get LinkedIn, get onto Twitter, demonstrate your practice, demonstrate what you're changing in your area of expertise, and don't be afraid to share it, because like sometimes nurses and midwives are a bit humble, and we're afraid to talk about how good things are, but it is really important when you make an improvement to patients and their care. It's so important to let other people know what's going on. So this is just a little case study in terms of models of care, and I suppose this is a model of care that is, I suppose it's a combined care. So myself and one of my nurse practitioner colleagues, we both were looking after this lady. So she is a 56-year-old lady, and we'll call her Molly. And she had a background history of pulmonary embolisms and DVTs, deep vein thrombosis, in 2011. She was on warfarin, then she was transitioned to a DOAC. She did have an elevated BMI, hypertension and hypercholesteremia. She had a family history which was significant. Her father had PEs and DVTs, and her sister had a PE, and unfortunately she passed away in her 20s as a result of that. So she was attending our hematology colleagues in August of 2023, and she was complaining of multiple menopausal symptoms. So my colleagues in hematology wrote to the general practitioner saying, look, it's safe to start on HRT. The recommendation was for her to start on transdermal. And again, so she was reviewed then in an outpatient appointment in February of 2024. Her menopausal symptoms were worsening, her mood swings, loss of libido, insomnia, hot flushes, and no HRT was commenced. The GP commenced her on an antidepressant, and this was of no benefit to Molly, so she just discontinued it and just thought, oh, this is it, I have to just get on with this. And this is my nurse practitioner colleague. She's so upset, and she calls me. Okay, so it was actually on Valentine's Day. So she called me, and it's again, that's what's the benefits of advanced practice, being able to call upon your colleagues and say, look, she explained the situation, and I was like, no, refer her to me. I said, we'll get her into the clinic, I will get her symptoms managed, and we'll get her going. So again, so I reviewed her in March, then I got her into my outpatient hysteroscopy clinic. This is where we do our hysteroscopies on our women with postmenopausal bleeding. So I brought her to the clinic and we inserted a Mirena coil. We started her on Eastradot patch, and I also started her on some vaginal estrogen because she was having a lot of vulvovaginal issues that I suppose, it being a gynae, we're not afraid to ask these questions. So again, that's what gives you the confidence to really get all the information that is required to give that holistic view of the patients. And we also advised that a DEXA scan, mammogram, would be really, really important for her. But again, it's lovely to be able to have that connection with other services that, you know, we can call upon and say, look, you know, this is where it needs to be, and they don't need to be waiting another 6 to 9 months. And that's the benefits to nurse practice, I think. And but it's great to be able to have that, and this is something that we're very proud of. And but it's just a little example of, you know, how we do combined care. In my own service, I would do a lot of combined care with our colleagues in oncology, women who may have had breast cancer and so on. So it's great to be able to have that collaboration and that closeness for advice and so on. But it's really, it is a rewarding job, and from an Irish setting, I think it will continue to evolve. I think we're always questioning, how can we do better? How do we know we're doing good? We're providing a good service. I think we're always have that critique analysis of our practice. But it's changing all the time, like it is globally. But it's something that I'm really, really passionate about. And again, I want to say thanks to April for inviting me to speak with you all today. And I'd be happy to answer any questions, or if there's any documentation that you may wish, please do send them on to me, and I'd be delighted to answer them. But again, thank you very much, and I look forward to observing the next couple of speakers over the next couple of months. So thank you all. Gur míle maith agam bhfuil agus slán go fóill.